Danielle, doula and owner of Chesapeake Birth and Baby. As an agency owner, we get a lot of questions about exercise during pregnancy and postpartum. So we partner with Kristen from BFIT Annapolis to get some safe and effective ways to do that.
Thanks for having me, Danielle. Pregnancy and the postpartum period is a time of great change happening to and in your body. So I encourage all of my clients to be patient and to be kind to themselves. Exercise should be seen as something that makes you feel good, that helps relieve pain, and helps increase your energy. And I would like to tell you that before you change your exercise program or start a new exercise program, please talk to your doctor.
Awesome. So let's start off with pregnancy. Give us one exercise that's great for it.
So a great exercise to do while you're pregnant is called a glute bridge. So Danielle, if you want to lie on your back, you're going to bend your knees and put your feet flat on the floor. You're going to drive through your heels as you push your hips up to the ceiling, squeezing your butt at the top and then lowering back down. And you're moving your whole torso as one unit up and then slowly coming down. Now let's try one more. Up and down. Good. So a glute bridge is great when you're pregnant because a lot of pregnant women complain about lower back pain. And if you have a strong backside of your body, strong glutes, strong butt, it's going to help alleviate and relieve that pain, help prevent it altogether in some instances. And it's also a great way to connect to your pelvic floor when you do that glute bridge.
The question we get a lot is when should I stop doing inversions when I'm pregnant or exercises that I'm laying on my stomach while I'm pregnant?
That's a great question. I would first encourage you to listen to your body for any exercise. If something doesn't feel right, it's probably your body telling you you shouldn't be doing it at this point. When it comes to yoga and core exercises, again, listen to your body. The size of your growing belly is going to prevent you from lying on your stomach pretty soon into your pregnancy. And then when it comes to inversions or anything in a prone position, I encourage you to be mindful of those exercises. If you're putting a lot of pressure on the front of your stomach, it's not ideal just because that's a compromised area because of your growing belly, because of your muscles that are possibly separating.
Great, so let's do one more pregnancy exercise.
Okay, so another great pregnancy exercise is called a heel drive. You're gonna lie on your back, and I really like to refer to this as an ab exercise because you'll feel it in your stomach muscles, but it's not going to be affecting that compromised area made by your growing belly. So you're gonna bring your knees up over your hips, and very slowly you're gonna drive one heel out, and then pull it back in, and then drive the other heel out, pull it back in. So you're keeping them slow, nice and controlled. You should feel these in your stomach pretty much right away. If you start to feel these in your lower back, you can either try driving your heels higher up to the ceiling, that will relieve some of that pressure, or you can try tapping down to the ground instead. Again, just listen to your body and do what feels good for you. Good.
Great, so another question we get is when you should stop doing ab exercises when you're pregnant, or if doing intense cardio exercise while you're pregnant is a problem.
Okay, well, to answer your ab question, I recommend that women continue to strengthen their core throughout their pregnancy and in the postpartum period. It's more a question of what type of exercises are good for your core and which ones are probably best to avoid. So just as I mentioned before, any type of prone position like a plank is probably better to avoid because as our bellies are growing, as our uterus grows, our ab muscles usually have to separate in order for our belly to come through. So that just makes this area a compromised area, not full of strong muscle anymore. So good reason to avoid planks in that prone position or any type of crunching move. And that's why that heel extension was great because we're working your core, but you're not crunching or in a plank. And then when it comes to cardio, I encourage my clients to ask themselves, why am I doing this type of cardio? Again, let's focus on positive goals, helping you feel good, helping you relieve stress, strengthening your body, and just avoiding intense cardio that might cause impact with another person or something like a sport, and then maybe avoiding a lot of jumping, something that could cause you to fall, just because we're a little bit more clumsy sometimes when we're pregnant.
Okay, great. Well, let's move on to postpartum now. And as always, please listen to your doctor and be cleared for exercise. Usually 6 weeks after a vaginal delivery, 12 for cesarean, but it can all vary person to person. Make sure your doctor says it's okay to start exercising again. And listen to your body. If you're feeling like it's not time to do that, don't feel pressured to do it. Can you give us some good exercises for the postpartum period?
Yeah, so a great exercise is called the dead bug, and there's different variations that we can do based on how you're feeling, how strong you're feeling, what feels good for you.
Okay.
So again, why don't you lie on your back one more time. And again, you're gonna bring your knees up over your hips, and you're gonna bring your arms straight up over your chest. You're slowly gonna push one foot out while you bring your opposite arm out, and then you're gonna pull it all together and then switch. So you'll feel this in your stomach, just like a typical ab exercise. Good, you'll get a nice stretch as well. Now, if that is too much, which it very might well be after having a baby, you could bring your feet down to the ground and simply do the arm move. And even with that, you should feel some good core connection working those muscles. Okay. So again, just listen to your body, do what feels good for you.
Okay, great. Thank you for your time. And if you guys want to find out more information, please contact ChesapeakeBirthandBaby.com or Kristen at BFit Annapolis for any questions.
Thanks for having me.